what I want to talk about, and I have the pride and privilege to share with you, is the new 21 through 26 strategic plan. It is the most ambitious plan in our 129-year history. We are committing $3.3 billion to this plan because we are so excited. And I want to thank all of you who have been engaged in this. I know many of you have your fingerprints. I want to thank our leadership who have shepherded this, and Patty and Libby and the planning team who have done an incredible job supporting and guiding us through this process, along with Mackenzie, our partner. And we had incredible engagement from our board through this cycle. It just, I don't know if it was a function of COVID, but just really, really amazing support with a very large strategic planning committee and a really enthusiastic endorsement of this plan, not because only of the merits of the plan, but because of this management team and their confidence in your ability to carry it forward. So starting with the plan, building on the past success, if you flip, I'm the slide flipper. Starting with the success of our last strategic plan and the plans before that, we truly believe that we are positioned to transform the way pediatric health care is delivered and truly lead the journey to best outcomes. And it always starts, like everything that we do, with the individual child. And whether that's a baby that's born prematurely, or a little girl like Aria who is diagnosed with cancer, or a teenager struggling with depression, we are focused on providing the absolute best care available. And whether that child is from Linden or for Upper Arlington or from Meigs County in Southeast Ohio, they are going to get the kind of care that families will travel around the world for. And we're going to do that by integrating our world-class clinical care and our cutting-edge research, where we're going to bring new discoveries, new treatments and cures back to the bedside. Many of our peers, whether you look at Boston or CHOP or Texas or Cincinnati, they all have this same charge. But I think what really distinguishes us, and it's something that Cincinnati shares, is our commitment to doing it to all of the children in our community with one standard of care. And I think the other thing that we've demonstrated over the last strategic plan is our ability really to translate our research not only to the bedside, but through commercialization to the broader community. But what really differentiates this strategic plan is this new unique ecosystem that we have developed that addresses the whole child, bringing together that world-class care and cutting-edge research with behavioral health, and really taking our leadership position and putting mental health on par with physical health, and being able to fight through the challenges of stigma, poor reimbursement, and staffing challenges to really lead this nation to better outcomes for our kids in this area. And then you think about genomics and the great work that our Institute for Genomic Medicine has done to build this platform where we are really able to transform the way pediatric medicine is delivered. There's probably 12 institutions around the country that are even in this game. And the way we've distinguished ourselves by bringing the clinical and the research together in one center is really going to differentiate. And the way that all of you and the various services are engaging with them to spread these new discoveries and opportunities to your treatments is going to be very powerful. And then finally, we're going to take our leadership position in population health and health equity and take that to the next level, building on our 25 years of experience with Partners for Kids and our almost 15 years with Healthy Neighborhoods, Healthy Families, and our new stand against racism and for health equity. We truly are going to go upstream and affect the social determinants of health and have the healthiest population in the country. And it is this ecosystem that really differentiates us. But that is all built on this foundation of these core competencies and capabilities that we need to execute on every day. We're going to maintain our leadership position in quality and safety, re-envisioning, reimagining our Zero Hero program and being maniacally focused on clinical outcomes supported with our new Center for Clinical Excellence. At the center of our success has always been our people and our culture. And our collaborative one-team culture is what has gotten us here. And I think over this next plan, as we grow geographically and as we expand with more size and more complexity, we're going to see this become even more important. And we're going to need to continue to be more focused and more committed to that one-team culture. One of the things that has driven our success in the past is these really long-term value-based partnerships. We do them with the children's hospitals, with the adult providers, with the schools, with the community. And you're going to see laced throughout this strategic plan this focus on partnerships, really to be able to leverage us to the next level of success. And as all of you know, anything that we are doing and all of these initiatives require the support of technology. And whether that's our digital experience for our patients and families and them navigating their care experience to advanced computing and all the work that we need in supporting our research and our clinical efforts, technology is going to be an important element of that, and we've worked very hard to develop some great plans for that. And the one thing that has propelled us through all of our strategic plans is our ability to execute and to operationalize this and to do it effectively and efficiently. And as I mentioned, we have a $3.3 billion investment that we're making, and Luke and his team have done the financial models to make sure that we can do that, but we need to be good stewards and make sure that we're executing on that. But if we do all of these things, we really will be able to impact best outcomes for children everywhere beyond Central Ohio. And so I think it's exciting that we are at this moment in time and have a shovel-ready strategic plan that we are really going to be able to affect the outcomes.